Primary care practitioners should remain vigilant for signs of burnout in themselves. And as helping professionals, we're always thinking about the patients we're helping. We rarely think about ourselves. And when we do think about ourselves, sometimes we feel even a little bit guilty for putting ourselves first. And yet, I like to remind everyone, when you get on a flight and you're listening to the safety instructions from the flight attendant, she or he says, put on your air mask first before helping those around you. And as healthcare professionals, we cannot take care of other people if we have nothing left to give. So it's really important to be checking in with oneself and seeing, how are my feelings about my job? How are my feelings about my work-life balance? And how's my energy? How's my motivation? And really looking for signs of burnout. Burnout is associated with a combination of high demands on the one side of the teeter-totter and low support and resources on the other side. That's the combination that really gets us into trouble. And the variables may vary for individuals, but what we're finding in reviews of physicians across the country is that it tends to be a combination of electronic health record requirements, of requirements for malpractice concerns, of healthcare policies for insurances, and administrative requirements that are starting to build up and just feeling insurmountable and out of control. And so on the one hand, people are having more and more administrative requirements coming from their job, and at the same time, a lot of providers are getting less and less time to see patients and more patients in their day. So now they're having more requirements on the one side and less time to complete them on the other side, and that's a really tough combination. So those are the kind of institutional and job-related demands that may be problematic. And then the work-life balance is really important. So even though we're healthcare professionals, we're people, and we have to think about our own self-care. And it's very easy for us to sit and remind patients that they need to get enough sleep and get exercise and make time for themselves and eat properly and stay hydrated. But we let those things go in ourselves. And so as healthcare professionals, we need to take a look at ourselves and say, am I getting adequate sleep? Am I getting adequate nutrition? Am I exercising or moving or engaging in hobbies that I like? And am I trying to keep a work-life balance with my family, friends, and other loved ones who I care about? And if that balance is really out of whack, it's going to be really hard for someone to maintain feelings of calm and peace and enjoyment and serenity and balance in their life. So a lot of times when that work-life balance gets out of a balance, it leads to feelings of burnout. So that's a second area that people want to look at, is what is their work-life balance, and are they having enjoyment and meaning in their life outside of work? And then a third area is the area of someone's emotional well-being. So anxiety and depression are actually very common in healthcare providers, and we rarely stop to assess how we're doing emotionally. And when we're not doing well, we don't always take the time to kind of treat ourselves. So saying, could I use professional help? And seeking help when stress, anxiety, or depression becomes overwhelming is really important. And in my practice, I'm a practicing psychologist, I actually see quite a few practicing physicians, residents, and fellows from quite a few different areas, from neurology, physiatry, and a bunch of different areas. And I think it's really important that people who care for others have a place and a time that they themselves can share their stress and talk about what they're going through. So I think giving oneself permission, if it's time to seek help, and get some social support and some psychological support when necessary. We really need our primary care professionals and partners to be involved in pain management. Pain is a national and worldwide epidemic of huge proportions, and the primary care professionals are the front lines. They're going to see most of the patients coming in with chronic pain conditions. So it's really important that they have the resources and the support that they need in order to care for these folks. And it's true that caring for people with chronic condition can be emotionally draining for the provider. And some reasons that someone might feel especially drained are not having good support within the office and administration, not having good social support in other aspects of their life, and not having all the resources that they need to care for patients. So some of the things that they may need to do are within the arena of the person themselves, and some things they may need to change maybe at more administrative level. So if the demands and needs of caring for people with pain are starting to become more than can be handled within the practice, it may be that the professional needs to reach out to their administration and say, I need more support. I might need more support staff or allied providers. They might need good professionals they can refer to, like a pain psychologist who they know, a pain psychiatrist who they can have at the ready. They might need more support themselves, like having other professional colleagues that they can vent to and talk about the difficulty and the frustration. So getting the resources and the support and asking for and accepting help from the community of providers, administrators, and allied professionals might lessen the burden a little bit. But I think it's okay for us to acknowledge that while caring for people with chronic pain is very important and a necessary part of caring for people in the world, it can be challenging.